Welcome to our antenatal sessions for those of you joining us to have your baby in North Cumbria. In this session, I'm going to talk to you about the stages of labour, what to expect, how you can help yourselves. If you find questions you have that are not answered here, you're welcome to send us an email, antenatalclasses@ncic.nhs.uk. We'll reply as soon as we can. Firstly, I'm going to talk about the latent phase of labour. This is the body's preparation stage before actual labour starts. What you can see here is a cross-section of a full-term pregnant woman's body. So by full term, we mean any time from 37 weeks of pregnancy through to 42 weeks. And that's a 5-week window of time where your baby might be born, which makes it really hard to plan for. But in this picture, you can see the arrow is pointing to the cervix, which is a 2 or 3 centimetre long tube, which forms the opening of the uterus or the womb. The cervix is the consistency of the end of your nose before labour starts, so fairly firm, and it's about 2 or 3 centimetres long. It has to soften and open and become like stretchy jelly sweets before labour. So there's a process in place that the body does with hormones before labour actually starts. So in this picture, you can see the baby inside the uterus, and you can see the very squished bladder at the front to the right of the picture, and the back passage and the spine of the mother behind the baby to the left. The uterus is made of muscle. It's actually one of the strongest muscles in the body. When it squeezes, we call it a contraction. So the body has to prepare for labour, and this happens over the last couple of weeks of pregnancy. Hormones can cause the cervix to soften and the vagina to become more stretchy. The muscle of the uterus tightens to gradually pull the cervix shorter and shorter. This is when people may notice mucus from inside the cervix falling out, and that's called a show or a mucus plug. This can be blood-stained, fresh red, or older blood, which looks brown mixed with mucus. Bleeding without mucus is rare but would need urgent attention. Some women notice this process, but it's not part of the actual labour, just the body preparing. We call it the latent phase, and it can last over several days, and it stops and starts in quite a random pattern. If women do feel contractions, the muscle of the uterus tightening, it's only once or twice inside a 10-minute time frame, and they may not even notice it at all. If you're not sure if you're in labour, you can always speak to a midwife if you need to. So active or established labour starts when the cervix is thin and opens to 4 centimetres. There are 3 or 4 or 5 contractions in every 10 minutes of time. So this is very different from anything you may have felt before in that latent phase of labour. What you can see here is a clock face showing you the 1, 2, 3, 4, 5 contractions in the space of 10 minutes. So you can see the 3 green strands represent contractions. It would be very unusual not to be able to feel these contractions in labour because they become a lot more regular and definite. I would say generally, if you're not sure if it's labour, it's probably not. But we're here to help you, so just ask. And when you feel ready to come to labour ward, or if you feel like you need your midwife at home, then just give us a call. At the bottom of the picture, I've tried to draw 5 contractions so you can see. So you don't need any fancy equipment to time your contractions in labour, just a clock. Count how many times you feel that happen within the space of 10 minutes. If it's 2 or less, it's probably not labour. If it's more, then it could well be that your labour's started. In this part of the slide, you can see some positions that might help your baby to be born. So gravity can play a big part in helping your baby pass through the pelvis. Your son and daughter will actually twist and turn to find the best fit. This all takes time. An average labour for a first baby can be 10 to 12 hours. It's usually quicker for a subsequent baby, but we can't promise. Here are some examples of positions to try, and they're mostly positions where the woman's body is upright. Moving around to stay comfortable can give your baby lots of options for being born. And I'm going to go on to say why things that you might have seen on television and film about lying on a bed is probably the hardest position for giving birth. So the pelvis is actually a curved shape like these pictures show you, and lying on your back actually means you would be pushing uphill against gravity. So being off your back enables your pelvis to open wider to help your baby to move through. In this picture that you can see on the right hand side of the arrows, it shows you that the pelvis is wider from side to side than it is from front to back. And actually babies do twist and turn to find the best fit through. So changing your position makes it much easier for your baby. So moving on to the first stage of labour, the difference here are contractions keep coming, they don't stop and start, they become stronger and more regular. So 3 or 4 or 5 of them in every 10 minutes. And it's not that you have to get to 5. Some women will labour with 3 contractions every 10 minutes, some with 4, some with a mixture of 3, between 3 and 5. Okay, so each one would start to feel as strong as the next one. So you don't get some strong ones and some piddly diddly weak ones. They all become much more stronger and regular. And once you get to that stage, you start to realise that things have changed. So you look back at any of the latent phase contractions you felt and realise that this feels different. It's very, very unusual to not realise that something more definite is happening in this first stage of labour. What's going on inside the body is that the cervix is opening from the 4 centimetres and it's going all the way through to being fully open, which we call 10 centimetres. And in the picture below, you can see the cervix fully open and the baby's head started to move down a bit further. And this process can take up to 12 hours. So this is actually the longest phase of labour. Some point during this stage, you'll probably want to call a midwife to be with you or arrange to come to the labour ward. This is the most likely time for the bag of amniotic fluid, the waters, to break open, but this could happen at any stage of pregnancy or labour. So we're not waiting for the waters to go before we know it's labour. We're really just thinking about how many contractions you're feeling. In theory, your baby could be born inside the membrane sac of amniotic fluid, but we would usually break the membranes open as the head was born to make it easier for us to welcome your baby. In these pictures, you can see first of all, on the right, you can see the membrane, the sac bulging out in front of the baby's head. And in the picture towards the left, you can see that the sac has popped and the amniotic fluid is flowing out. There's no such thing as a dry birth. That water will keep coming until the baby's born. But if you think your waters have gone, it's good to let us know so that we can check you both over. The second stage of labour is all about the stage when the baby's actually born. So in the second stage of labour, contractions will move the baby down through the pelvis, and we often call it the pushing stage. Women often feel they need to have a big poo because it's all pressing on the nerve endings in the same place. Contractions change their job from pulling the cervix open to pushing the baby out. So contractions continue being strong and regular, 3 or 4 or 5 of them in every 10 minutes. And this stage again isn't always quick. It can take an hour or 2. In the picture, you can see how the baby's head can change shape to fit through the pelvis. Hopefully, a baby will tuck its chin on their chest and bring the very back of their head out first. The head is elongated, but it won't stay like this for long. I can remember the first time I saw a baby being born, and when the head came out, it looked a little bit like a hairy elbow. So it can be confusing to know what's coming first, but this is all part of the design. A baby's got separated skull bones to allow for an easier birth and to make space for its developing brain afterwards to grow really quickly. So in the bottom picture, you can see how the baby's head is shaped, sort of elongated. And then in the second picture next to it, it's actually much rounder. And the only babies who are born with fully round heads are those who've never been down into the pelvis, so perhaps born by caesarean section with no labour. In these pictures, you can see the baby gradually being born, so the head comes out gradually. It can look quite shaped. Sometimes you have to wait after the head's born for another contraction before the rest of the body is born. The baby actually does a quarter turn to allow one shoulder out before the other to make it easier. In these next pictures, you can see a baby being cuddled in a skin-to-skin position. There's lots of research that's been done about the benefits of holding your baby skin to skin after birth. It helps them to get to know you. Of course, they'll already be used to hearing your heart beating and the sound of your voice. Babies are usually wide alert and interested in feeding in the first hour after being born. Take the chance to start feeding your baby as soon as possible. After the first hour or so, they'll probably sleep for around 4 to 6 hours. We call that first hour after being born the golden hour. So we really encourage skin to skin if you feel like you can do that, for the following reasons. It reduces your baby's stress hormones. It gives them access to the breast quickly if you're wanting to breastfeed. It helps them benefit from your healthy skin bacteria, which is good for their immune system. It gives your baby a chance to meet you, see you, hear you, feel you, and smell you. It keeps babies warm and helps them adapt to life outside of their mother's body. And it helps to stimulate the hormones in the mother's system to reduce bleeding and produce breast milk. The final and third stage of labour is all about the placenta, or the afterbirth being born. So once the baby's been born, the rest of the membranes and placenta need to be removed from the uterus. That uterus, the muscle, continues to contract to help this along and stop the area where the placenta's been attached to not bleed so much. Placentas are like dinner plate pieces of liver meat, and have the cord and membranes attached. So in this left-hand picture, you can see the placenta starting to peel away from the inside of the uterus, but still inside with the cord hanging out. And in the second picture underneath it, you can see the empty uterus, which is smaller than the picture above it because it continues to contract to get it down to the pre-pregnancy size. And in the picture on the right, of course, you can see an actual placenta with the cord, part of the cord still attached. There's two main methods for managing the third stage of labour: physiological or natural, where we just wait for the body to do this process on its own. Or we can use active management, where a small injection of hormones given into the mother's leg before the midwife pulls on the umbilical cord to remove the placenta and the membranes. Either way, it's usual to wait for the blood inside the cord to finish moving to the baby before we cut it. Birth partners might wish to be involved, but there's no expectations if they'd rather not. The choice over how to manage the third stage is with the mother. However, there will be times when we advise an actively managed third stage to reduce the chance of heavy bleeding, and using hormone injection has become the most common way for us. There's several things we would do quickly if bleeding did become more than expected. After the placenta's safely out, we need to have a look to see if we need to repair any tears or cuts to the vagina with stitches. Usually we can do this in the labour room with some local anaesthetic to numb the area. However, sometimes it's best done in the operating theatre with more pain relief. After that, we encourage you to just chill out with your baby and get to know each other whilst we're on hand to help if you need us.